Namaste. I welcome you all to the 57th session of GURUBODHA. We have with us Dr. M.D. Gururaja sir and Dr. Raghuram sir and the convener Dr. Janardana Vihebba. And this class is made live exclusively for Easy Ayurveda Weekly class subscribers. If you want to sign up, please do that easyayurveda.com/video-classes. So, sir, it looks, if I do not read the what it is given, it looks like, there's a swelling in the joint, there is this white patches, maybe vitiligo, okay, there are some ulcers, maybe vrana, maybe arthritis. It looks a combination of many things. So please, from, just from seeing this case, what and all observations you start making and what and how you approach this case, how you approached this case, and what was the journey for 1 month that you have posted this picture.
He is a 45 years old male, and he approached it to me with particularly a non-healing type of ulcer and discoloration in the both medial malleolus, and along with that there are swelling, burning sensation, itching, and recently some ulceration started and oozing has started. And he is not a known diabetic or even hypertensive, but he is a severely obese person. He weighs 118 kilos when he came to me 1 month back. So when I observed his both the legs, they are very typically blackish in color, swollen with a lot of engorged veins, and this swelling is not actually in the joint, but it is around the joint, and it is due to what you call stagnated, or there is a difficulty in the blood circulation, there is an obstruction in the path. Because of that, there is a swelling, discoloration, and slowly the discoloration went into a hypodermic patch, and slowly it opens into a ulcers. This is usually which happens in case of venous ulcers formation, or it may be venous insufficiency. This patient has even deep vein thrombosis, and of course typically it happens in that fashion. And the commonest site is being that medial malleolus or even the lateral malleolus to some extent. In this case, it is around the ankle joint totally. And since last 1 month, I have given him the medication for 15 days duration twice, and I have made him to eat very less, and I have made him to cut down on his non-vegetarian diet as well as many other food patterns. And during this 1 month time, he has considerably lost 13 kilos of weight just by controlling over the food. And he has also, this swelling has reduced considerably. Pain is almost not there. Swelling has also come down. Burning sensation is also not there now. So this is the thing, and it is very clearly, we can take it as Siraja Granthi or Margavarodha accordingly. Then Vranavat Upacharyat, according to Vrana, this needs to be treated. So when there is a blockage, we need to select a Pramati Dravya or a sharp Tikshna Dravya which can penetrate, or Amlarsa Dravya which is very good to the heart and which will keep the blood thin and it will be moving. So based on these concepts, something which can do the digestion of the ama or the blockages and opens the channels, I have selected Guggulu Tiktaka Kashaya and syrup Cardorium Plus. It is available in the market, and capsule Viscovas. These 3 drugs were selected, and he is being given this one at a dose of 10 ml thrice a day, and Viscovas capsule was 1 capsule 3 times a day after food. And externally, I have given him to apply Panchavalkala lepa and dress it properly, and with mild exercises I have suggested him. And now after 1 month of time, that is what the comparison photograph I have given, the changes are seen in such ulcerations have gone totally healed up, swelling reduced, circulation improved, no pain, no burning sensation, all these things.
Wonderful progress within a short bit of 1 month there, sir. Coming to this obesity and vascular problems, there I'll come to Dr. Gururaja sir regarding this, but Dr. Raghuram sir,
Yes, sir.
obesity with veins engorgement, varicose veins are also very common in obesity. So how to understand obesity and these sort of vascular issues? So,
See, when we speak about the correlation of certain disorders, if the person complains that the varicosity or the skin conditions, what Gururaja sir has beautifully explained and dealt with that particular condition, if those conditions have appeared after the person started gaining weight, we need to see the prakriti and vikruti of the patient also here. So whether the person was prone to increase weight or prone to decrease weight. So we have different categories of people. I always ask this question to my clients, like, do you have a proneness to increase the weight? Like doing nothing and just leave that person X, if we consider a person X here, if we leave that person for himself or for herself to be whatever they are, do they have a weight gaining tendency or do they have a weight losing tendency? Okay, so that is very important. So to also analyze the prakriti, and later some people may tell at birth or in the middle part of our life we were moderate or thin and suddenly started gaining weight. So suddenly started gaining weight is not normal to that person. So that comes in as a vikruti. So even in a person who was kapha prakriti or whatever, so it can come. So we need to analyze what type of prakriti the person was and what type of vikruti the person has right now. And coming to obesity and gain of weight and everything, if we consider staulya, medoroga, and all the medovruddhi and all those conditions, we know that the medas individually has the capacity of uploading certain things, including the blood vessels and other things, and also create pressure symptoms. And also, when there is excessive accumulation of fat in the body and the body is not able to dispose that, a balance. So like there should be a balance. So like the fat metabolism should be really good. The bad fat should not accumulate in the body. The body should continuously keep cleansing it or flushing it or balancing it. So when there is an imbalance between formation and depletion, so that obviously takes to so many other conditions. When we read the Medo Roga in Madhav Nidana, it indicates it is a very difficult condition to handle because of the Viruddha Upakrama. Try to treat the weight or the kapha and meda, vata will increase, try to handle that, this will increase. So it is a tricky situation wherein we can handle. That is why probably the Medaroga or that is Atistaule has also been explained as in one among the Ashtaninditiya, so like one of the Nindita Purushas. So when we see all this, so obesity or excessive weight gain or excessive accumulation of fat and the body not able to understand the fat metabolism and convert it. So may also get into autoimmune conditions related to the fat and fat blocks and cause many skin conditions like this. The trick of diagnosis is when the person complains, I did not have any issues like this, like the one I am telling about, Dr. Gururaja sir explained now. I did not have these conditions and slowly started developing those conditions, or those conditions manifested once I started gaining the weight. So here it becomes a very important priority to address the fat issues, obesity, weight gain, along with the treatment of that particular condition. I can see Gururaja sir also has given Guggulu Tiktaka Kashaya, which also acts on Medas and also Medavaha Srotas. So that was also very important there. And also a comprehensive package of the medicines. At the same time, if some therapies are brought in, so that also will play a very good condition, like a Virechana, effective Virechana, along with Udvartana. So Udvartana, Snehana, Udvartana, Swedana, and Virechana in that particular order. And also very importantly, diets in the pattern of which neither depletes the medas totally nor adds to it totally. So the weight what Gururaja sir explained, maybe 118 something Gururaja sir said. So that is really a big issue. We need to see where did the person progress to 118 kgs. So that's my small question to Gururaja sir. So was it like he was always obese and very bulky and slowly moved towards 118, or the person was moderate and moved towards 118? So this is also very important. So handling the medas is tricky there. That is also very, very important. If it is a nidanartakara, so if the symptoms develop after the development of or the accumulation of fat in the body, bad fat in the body, or the weight changes in the body, then that needs to be handled simultaneously. And Gururaja sir rightly mentioned about the patya also, putting him on the a reasonably planned diet. So that is also important. On the lines of samsarjana krama, if we can do, still good enough. So we need to see the nutrition is balanced at the same time. The fat related disorders, Medovaha, Sroto, Dushti, Janya, Vikara, if we can consider, if we can address that one. Else, if it is not that case, as in this case, we can handle this case in the on the lines of Vrana, Vatarakta, or Kushta. So whatever. So in that or Dushta Vrana maybe on the lines of the treatment explained by Master Sushruta. So this is my opinion about this.
Extreme obesity, like in the present case, there will be extra pressure on the heart to pump blood because the fat layer is so thick in all body parts. So the circulatory system, heart and the blood pipes had to work really extra harder, leading to all these problems.
See, definitely these type of issues will be there. But the problem is, in practice, when this patient approached me, he was so confident about his body weight. He feels it is healthy. So he never feel that 118 is a big problem. He says, I was doing all sort of work. I was doing so much of work. I was no problem at all. Just now it started from last 6 months. Otherwise, I was eating everything and doing every work. I am a very strenuous worker physically and mentally also. So like that, he was so confident about his behaviors. But when I said that your body weight is not matching with your height and age and this is too much, and because of that you are developing all these things, then you're saying, oh, I didn't know this. So of course, the education background is also comparatively a lesser one. So they may not understand things. But now, very meticulously he follows the guidelines what I have given to him. I just suggested you need to avoid totally non-veg. He pleaded in the beginning, at least I can go for egg, and I said, no, don't take Guru Ahara. Leave it totally. Reduce your body bulk and reduce your diet intake. Let your body feel deprived of nutrition for some time. Then it almost try to take the things which is kept in the stores. Then your body will reduce. But he typically done that, and now within 1 month he has lost 13 kgs. I have not ordered any specific drug to reduce his body bulk. Only I suggest him to control the food what he takes and the quality of the food. And moreover, I have suggested him to just do a little bit of walking and supportive type of exercises so that he can improve these conditions.
Yeah. So again, speaking about Medas, so that was substantially really good, Gururaja sir. Like 13 kgs reduction, I think that was a really good result in seeing that 30 days duration of treatment was given. That is really fantastic. So also we need the Chikitsa Chatushpada to work out. The patients to go according to the instructions of the doctor is very important. Taking the person into confidence and allowing them to understand what exactly is going on is also very important. And Meda Savruta Margatvat Pushyanti Anye Na Datavaha. So in Madhavanidana Medaroga Prakarana, we can find a beautiful quote. Meda Savruta Margatvat Pushyanti Anye Na Dhatavaha. So once there is Meda Savarana, it is like Bhima. In Mahabharata, it is like Bhima. So like what we can call it as a bulk absorber. So once the Medas sets in the system, so the fat sets into the system, when it starts accumulating, it blocks almost all the passages, srotas, all the cells, depleting the nutrition to almost all the cells and tissues. We have a chronology in Ayurveda. So Rasat Raktam Tato Mamsam. So in that chronological order, Rasa to Shukra Dhatus are formed. But when the Medas itself is nourished to a very large scale, it takes away the entire nutrition from the upper dhatus and the lower tier dhatus, like Rasarakta Mamsa. Their nutrition also it is taking, and Majja Shukra, Asti Majja Shukra, their nutrition also it is taking. So that is why Meda Savarta Margatvat Pushyantanyena Dhatavaha. So that itself indicate what amount of or what gradient of immunity may be compromised in that particular person, because no tissues are nourished and they are at a very bad health, their agnis are varying, and Medas alone is luxuriously developing inside the system and creating an ideal environment for many diseases to manifest. So among them, the skin related condition, blood vessels related conditions, so many conditions we know. So that itself has laid a foundation and the base for many problems to manifest, and addressing that Medas is very important in any condition. So probably we should be looking at Medas Avrata Margatvat Pushyantanyena Datava should be one of the golden guidelines for Ayurvedic doctors, wherein we need to look at certain problems, especially metabolic problems running into our clinics. We need to see if the Medovaha Srotas or Medovaha Srotodushtijanya Vikaras are manifested in some conditions of Pandu. So what we can consider, or if we can take some anemia and other conditions also. In my clinical practice, after handling the Medovaha Srotodushti, the symptoms of anemia and other things have improved. The blood picture has improved, HB and everything, oxygenation and the feel good reports from the patient, feeling lightness, everything comes in automatically when those things are handled. So any metabolic disorder or any chronic condition coming to our clinic, it's very important to see in the backdrop behind the door if there is a Medas accumulation or Medovaha Srotodushti.
Yeah, and thank you very much for a detailed analysis regarding how fat deprives of fat tissue excessively when it is vitiated. It deprives the other things. So, Guru, coming back to the treatment plan that you can you please elaborate why you chose this? What is the logic?
It's a very typical combination what our acharyas have made. This Guggulu Kashaya, it works wonder in many Kafaja Vikaras, many Rakta Vikaras, many Vataja Vikaras. So it is wherever there is a chronicity of Vata disorders, Guggulu is the drug of choice. It can be given. Where there is a Kafaja, there is a skin condition which is having chronicity. Where there is a Arbuda, Apachi, Granthi or something like that, that is a drug of choice. So wherever there is a solid ama is obstructing the path to digest that, that is the Guggulu is required. So in this way, many a time Guggulu was wonder. Of course, when this Guggulu is deprived of only the Amla Rasa Dravya, that's the reason when we add Amla Rasa to this, then definitely it will leads to a very good clinical outcome. That's the reason I have chosen that Cardorium Plus, which contains Arjuna as well as even the two important Himalayan herbs, which are very rare herbs. That's the reason very typically it works. And of course, it also has some sort of Amalaki in that. So even Amlarasa is very important. Amlarasa Hridyanam, Amlarasa is very good to the vessels. It very typically we also know that when Amlarasa is introduced or given, it segregates the fat metabolism. Fat molecules disintegrates the fat. So thereby it helps the way to for the flow of the blood. So with all these background thought, and already I'm using this combination since many patients I have used. So it gives me a confidence that if I use these drugs in these conditions, definitely there will be right kind of outcome. So that's what it happens, and I'm using it since so many years, definitely, and it is giving a good results.
And regarding Viscovas, a few words, please, and also why Gandhaka rasayana.
Viscovas is also like Amapachana Dravya. It contains an penetrative Tikshna Guna Yukta Dravyas. Chitraka is also present in such type of things, and it is from Atrimat company. And of course, it's once again for the improving of the circulation, blood circulation purposes. So in order to overcome the avarodha and the avarana inside the vessels of Raktavashrotas, So this has been a proprietary medicine. What the company has claimed, and they have tried in many conditions, and it supports the condition. So I'm using it. That's the reason. Very simple thing that why I don't want to hide the combination or these things. I have used these drugs and I got the results in this fashion. If I disclose these combination, let somebody across the globe in somewhere in the similar situation, if they use it, then it itself is a multicentric data. It gives you idea that how the drug works in different conditions, whether it is a true or false, or whether the result outcome is just by coincidence or really drug is working.
And yeah, Viscovas is tremendous. They have thoughtfully added all things which are related with opening of the body channels. Even the horse gram or kulhata is there in it. Very well. Few words for Gandhaka Rasayana, why it is there in your prescription, sir, please.
Gandhaka rasayana is also one of the important drug where puya, lasika, and this type of kapha and where there is itching, kandu, and these conditions are there, which very clearly supports. So that's the reason I use it Gandhaka rasayana. And Gandhaka rasayana in these cases, because we have developed Gandhaka Rasayana in such a fashion that we have meticulously followed the 72 bhavanas without any compromising the manufacturing practices. And we came to know that our Gandhaka is also having a very nanoparticle size inside that. And even nowadays, I'm trying using this Gandhaka even by rubbing it water and applying as a lap also in many skin condition, and it is giving a good result. So typically, Gandhaka is working in a wonderful way, and wherever there is these things, or even the fungal infections or something like that, or itching conditions, or oozing condition, definitely I would add Gandhaka Rasayana, and definitely it works wonders.
Yeah, Gandhaka Rasayana is prepared with pure Shuddha Gandhaka is taken and it's given bhavana with so many things. Wonderful, great. Taking the counter view, that these are all, I would say, improving the blood circulation, etc. If I say that there are no medicines that are particularly improving the strength of the veins, what do you have to say about that, sir?
See, body has a special tendency to repair itself. Only thing is that we need to give the supply, proper supply of the materials. So when I open up the channels, see, just like how our border roads were not developed, when we find it very difficult to carry our weapons and even human resources to the border at the time of requirement. But now everywhere there is airstrips and borderline organization that they have done very wonderful job like that. When we have an approach and clear the tracks and there is a connectivity, definitely the things can be moved in. And whenever the supply chain is maintained, automatically body takes the material and builds up the tissues. Whatever the damaged tissues are there, that will definitely get repaired. And this process of repairing is definitely going on without anybody's intervention, but it will be slow. If you open up the channels and clear the track, supply is continuously maintained, then the healing process will become fast. That's the reason I concentrate on opening up the channels so that the blood will move. Along with that, while it is carrying, it carries the nutritions and what are required, and that will be building materials that definitely they'll be utilized to build up the new tissues, and the wound will be healed and everything will be settled down. So that's why the channel should be open.
Very good, Saraswati, sir. Thank you for clarifying the doubts. And Raghuram, sir, another thing that he told me, which we briefly touched, is Bhishak, Vashya, an ideal character of the patient. How to make patients Bhishak, Vashya, or what is Bhishak, Vashya, and how is there any tricks to make the patient Bhishak, Vashya?
Definitely. See, when I do consultation and even after the consultation, so I give my time. I believed in giving time. So as Dr. Hebar also knows, so he keeps telling me, see, do it as simple as possible or go according to the time. So because we have a lot of time and other things, many times I overdo and over cross the timings also. So that is not only the plus point. So spending the time to the with the patient hearing first of all, and allowing them to explain, not moving with the emotion, but getting connected with the emotion of the person. So when we remember a scene from one of the super hit Hindi movies, Munna by MBBS, there the dean tells, treat the patient as a subject. That's all. Don't get emotionally connected. No need of getting emotionally connected. But on the other way, see, our approach towards the patient should be such that the patient themselves will get emotionally connected with us. So half the healing shall be done. Last couple of consultations, what I have done, I have not even prescribed a single medicine, and the patient are so happy. Not even prescribed a single medication. I just suggested the lifestyle changes, and these things need to be done. And you people are overthinking or overdoing these things. So recently, yesterday or day before yesterday, one of my patient wrote. So the recent consultation wrote that the doctors were just trying to push me some medications and trying to sell themselves. But you did the right thing, doctor. After a couple of years, I found really happy that you did not mention a single medication. You just suggested me to follow 1.5 months of at least 50 days of what you said, and I'm already started feeling better after speaking to you. See, this, if we can get it into the minds of the patient, speaking to the doctor should be like speaking to a friend, and the counseling part should be really good. Speaking to the, be it a small condition like a rhinitis or a fever or a very chronic conditions where we know that we cannot do a lot, but we can help to a particular extent. So this is very much essential, especially when the patient is out of India and out of reach of Ayurveda. Ayurveda doctors are not available there, and shipping the medicines also will be very difficult. I always believe in three principles: Charaka, Sushruta, Vagbhata. So these things are very, very important. Charaka is exploring. I keep telling, Charaka means Chara, explore. First of all, the physician should explore into the theory, explore into the minds of the patient, into the emotions of the patient, try to gather as much of information as possible. So be a Charaka first, explore. So in my clinical practice, what I do, for most of the conditions, I don't do an immediate prescription. So I take time, understand the case. So though with more than 25 years of clinical experience, I handle every case as a new case and a fresh case. So what I do is the Charaka concept. So Chara, I explore it into depth. How is this patient different from the other patient? So there are general principles of treating Samanya Chikitsa, we have discussed many times, and specific. So here we are speaking about the personalized approach. The patient will be very happy with the personalized approach. Know the patient by name or the client by name. Next time when they email or when they come for a follow-up consultation on the whether it may be the e-platform or email consultation or online consultation, or directly you are seeing the patient. When I address the patient by name, there itself half the problems are gone. Okay, doctor remembers me. Doctor remembers my problems. I may not remember all the problems, but if I can remember those small things related to that particular client, it is very difficult, but that will really help. So be a Charaka first, then be a Sushruta, patient hearing. Sushruta, there is Shruta. Have a patient listening. Collect all the information. Don't meddle with the patient. Let them express whatever it is there. They have set of complaints, 100, okay, and we should bring that 100 symptoms, the summary, shortlist it and bring it to what we want and how we are looking at it. Very important. And then Vagbhata. After that, walk. So I have the authority to speak, to advise, to give the prescription. So by doing all these things, I think it is not a rocket science. So here it is very important how we get connected at the first instance. First instance is very, very important. Love at first sight is true with the patient and doctor also. That compatibility development is very important. That getting connected is very important. Nowadays, the prescription is already ready. The moment the patient comes into the clinic, I have seen personally my elders taking them to cardiology centers. I don't want to just blame any other science or anything. So they don't have time. By the time we enter inside, we have so much of waiting time, like waiting for 2 hours maybe 1.5, 2 hours for an expert, and then going in and just submitting those records. They'll say, okay, how is your complaint? Okay, done. So continue these medicines, +1 or -1 is done. Over. So there is no connect. The patient will go and continue those medicines and come back after 1 month. So that is not how we, and very important is get the patient involved. The P4 medicine, I think Dr. Rebar, once we should have a session on P4 medication. So very important. So here P4 is personalization, predictive medicine, personal medicine, and very importantly, the fourth factor comes is the participatory medicine. Participatory. Let the patients participate. Let the clients participate as a festival. Their healing is the festival. Nobody knows the patient better than a patient themselves. They are the masters. I can know about a patient only when he or she tells me, but they will know A to Z about them, how they can do, what they can do. So very important is customizing the medicines, customizing the advices, customizing the diet protocol, lifestyle activities, exercise, everything as it suits them. We also need to see mano ahladakara. So like when we please the patient or the person and we put all these treatment protocols in a comfort zone where they can take, which differs from person to person. So it will be, I think, superb. So there are so many techniques. So I think over a period of time, I learned to give time to the patients. So patient and patients. So these two are very important. Both should have. The doctor should have the patients. Patient should also have the patients. And the Chikitsa Chatushpada should work out. All those four limbs should work out. So a better talk, a better interaction, better communication, better follow-up, and keeping the link and allowing the patient or the client to participate in their healing process is very important. So they will be really happy to get connected to you. And I tell my patient or the client that they ask me, when do I come for the next time? I tell them, why do you even come the next time? This is not a picnic. This is not something, a theater. You come and enjoy a show. No, you believe in yourself. After this consultation, keep a target. Within next 30 days, I'll start getting better. I always, one advice definitely I'll give my clients. If your arthritis is in the knee, I can treat you. If your arthritis is in your mind, nobody can treat you. You are the best person to do that. Okay, allow the problem to be where it is, and we will handle it from there itself.
Thank you, sir. And Gururaja sir, asking you about like how did you convince, two questions. How did you convince this patient to lose 15 kgs, 13 kgs in a matter of short period of 1 month? And also, what do you do when the patient requires counseling and your other patients outside your clinic are waiting?
Usually, I take my own time of convincing and what I need to convey that patient. Definitely, I do that without considering any time, extra time or something like that. I don't mind and sparing some time. But my intention, whenever any patient comes into my chamber, that he needs to carry the information which I am suggesting to him for the benefit of his as well as my success in this treating this case. So that's why I take my own time on explaining the things. I'll try to explain them why it has happened, how it has happened, what is the reason it has happened, and what are the possibilities it will may go into a wrong direction if you don't treat it, and what is the necessity of doing patya, and why need to reduce the consumption of these particular things. If you do it, what will happen? If you don't do it, what will happen? I'll explain everything. And even lastly, I'll ask them, do you have any questions to ask? They'll be finished with their questions, then they'll be happy. They'll feel good that I'm convinced and I'm definitely going to do it. And I make them to feel that they should go out of my chamber with a sankalpa that they will do it. So that's what usually I do it. And definitely, and those patients who are already run to many doctors and shown to many places, taken medicines, and now they are understood the disease condition. It is deep seated and it is giving a lot of trouble. And they definitely understood that there is a disturbance and it is a deep disturbance. I need to check it out or I need to fix it. So let me start how the doctor is telling, and automatically they become Bhishak, Vashya. And many times what these patients do come to me, they're either referred or something like that, or some by my earlier patients, word of mouth advertisement or something like that. I have gone to that doctor and the thing has been settled down, so I am referring to you. There, go on, just check it out. Or by photographs of these type of comparative studies which I show it. Usually these things will make them feel comfortable and convince them that their condition is also going to be relieved by the medication and the procedures what they follow it. And I make them convinced that how it's important to make the lifestyle changes. If you make these things, that will be out of many diseases. Otherwise, in future you may land up in these diseases. So definitely these words and this way of convincing, and definitely the most of the people will get convinced. And of course, when the patient is from the rural background and education wise it is a difficulty in understanding things, then we need to be very cautious what we explain. And we need to pinpointedly explain to them what they need to do it. Simply behind the thing, what is happening, why it's happening, if you explain the total theory or the complexity of the issues, they may not be in a position to understand. So then that reason time, usually it is it's reasonable that we should tell them this is happening because of this, you need to do this particular thing. And they will be usually, that a rural set of population will be definitely a Bhishak Vashya type of people. They'll usually carry out the things or the guidelines which is given to them.
It's really blessing to have a skill of convincing the patient, especially when his thinking was that obesity is normal in that case. Yeah, and another point that I draw from your narration is that authority is also important. That patient has come to you because of referrals, and they already know that you are the authority of science. And with GURUBODHA, we are making it available even for the common public. With the hope that more Ayurveda practitioners are enabled and their knowledge is upgraded, reskill and upskill. That is a mantra for that should be the mantra for all Ayurveda practitioners. More we read, more we learn from experts like Dr. Raghuram sir and Dr. Gururaja sir. Thank you, Raghuram sir. Thank you, Gururaja sir.